Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks, also free of charge. Treatment at medical level. The medical level, there are usually two paths to follow in terms of treatment. One that has to do with the restriction of certain foods, and the other with the administration of drugs to control the predominant symptoms. Hygienic dietary measures. Foods and drinks that trigger or worsen symptoms. Toxic substances such as tobacco, stimulants such as alcohol and coffee, those that produce excessive gas, etc., should be temporarily avoided. Physical exercise is recommended. Exercise appropriate to the patient's age and, above all, a sedentary lifestyle should be avoided. If constipation predominates, an increase in fiber intake is recommended. Fruits, vegetables, cereals, salads. Drugs, only when the intensity of the symptoms so advises. That is to say, in the event of symptomatic crisis, these drugs are aimed above all at controlling the predominant symptom or symptoms and for a limited period of time. They may be spasms, inhibitors, spasmolytics. Treatment by hypnotherapy. Hypnotherapy is recognized as a valuable treatment for irritable bowel syndrome to the extent that specialist units have been in existence in the UK since 2002. 80% of patients show sustained improvement in their symptoms after several sessions of hypnotherapy. Particularly in women, hypnotherapy has also been shown to alleviate extracolonic symptoms, to improve quality of life, and to help patients return to their work activities. The effects of hypnotherapy are based on the induction of a deep hypnotic state, during which suggestions relevant to the individual are made that reinforce the ego. This technique is accompanied by other interventions, such as the administration of heat to the abdomen, hypothermia, or self-hypothermia, using the hands and the imagination, both aimed at controlling and normalizing bowel functions. Hypnosis sessions focus on imagery and techniques aimed at normalizing bowel function. For example, patients place their hands on their abdomen and a feeling of warmth and comfort is induced. Or they are induced with images symbolizing the altered bowel in relation to the representation of its normal function. An image commonly used in patients in whom diarrhea predominates is that of the bowel as a river flowing very quickly, and which is immediately imagined as a river flowing slowly and gently. Indicative lists of possible foods to pay special attention to your reaction to which you may have an intolerance. Keep in mind that these foods do not necessarily have to be bad for all IBS sufferers and all IBS sufferers. Wheat, dairy products, coffee, caffeine, tea, chocolate, refined or processed foods, candied fruits, carbonated beverages, sachet soup. People with IBS should be aware that there are specific foods that make their symptoms worse. However, when tested for food allergy, they do not test positive for any of them. It is not necessary to be allergic to a certain food for it to have a negative effect on the body. Hence, the term food intolerance rather than food allergy. An allergy is an almost immediate reaction to an antigen that enters the body and the body reacts to it. Food intolerance can be an immediate reaction at 2 hours or 24 hours or 48 hours, to give an example. There are different degrees of intolerance: low, medium, or high. Depending on those degrees, the body will react with a certain intensity and in a certain period of time. Reduce, or if possible avoid, the consumption of the following foods, as they are difficult to digest by the organism: white sugar, caffeine, excess fats in a single meal, for example fried foods, dairy products, and wheat if you are allergic or have an intolerance, soft drinks, artificial colors, preservatives, and flavoring, which is practically mission impossible. Taking dietary supplements. Polyvitamin complex helps repair nutrients deficiencies resulting from poor digestion, being some of the most important. Vitamin C counteracts acidosis, supports the immune system. The vitamin B group plays a fundamental role for the central nervous system, CNS, in such a way that low levels in the organism lead to a physical reaction to dysfunctional stress. This vitamin is known as the anti-stress vitamin. Vitamin A is involved in the formation of the mucous membrane, lining the intestines. Zinc improves the reaction to stress and in the treatment of inflammatory processes and participates in the formation of collagen fibers. Magnesium, an inadequate level in the organism, impairs intestinal peristalsis. Probiotics helps to repopulate the intestinal walls with natural flora. Fiber helps to formation and therefore proper bowel movement. Combination of digestive enzymes involved in the digestion of foods. Although in this case caution should be taken. Not to be taken on an empty stomach. Not to be taken in case of ulcers in the digestive tract. If you're interested in learning more about clinical hypnosis, watch our next video: Eating Disorder, Binge Eating and Anxiety Script. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comments area about this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.